Good afternoon, ladies and gentlemen. My name is Daan Naicker. I'm going to present to you some of the work that we're undertaking in response to the COVID-19 pandemic related to a collaborative development of a ventilator test lab. And that collaboration is between our manufacturing cluster and the South African Bureau of Standards. So let's just get straight into it. So just some background. So when the pandemic hit in 2019, CSIR, under the National Ventilator Project, undertook to develop CPAP and BiPAP devices. I believe one of the sessions my colleague presented the BiPAP ventilator system. Now, during that period, there were a number of entities that had cropped up developing ventilators left, right, and center, and the need arose to try and vet and accredit these ventilators. So the DTIC provided some funding to see how could we set up a ventilator test lab to qualify and accredit ventilator systems produced either locally or abroad. The SABS, due to its standards affiliations, was identified as the appropriate institution to perform this accreditation. And because of CSIR's involvement in the development of these ventilators, they were identified as the party to provide the test facility. An MOU was established in 2021, and under this MOU, the laboratory itself was to focus on a new SABS standard for ventilators. This would be the focus of SABS. And also in terms of the regulatory needs for South Africa, this is what SABS would then focus on. CSIR's role in this endeavor was to establish the physical laboratory itself. So some of the requirements around the development of this ventilator test lab revolved around the ISO 82601 specification for ventilators. And this dealt with three key aspects around basic safety for ventilators, the essential performance of ventilators, and the functionality. Now, during the development of the CPAP and BiPAP devices, we needed to ensure that the system we developed met the criteria. And what you see presented there was a very crude setup, to say the least, of how we were able to validate these systems. So the system that you see there was a locally sourced device that enabled us to test the CPAP devices. And what you see there is a system that was acquired from abroad that helped us to test some of the BiPAP devices. Now, as you can see, that's a very crude setup, and given the time frames that we are looking at, this is all we had at the time to test and validate the systems that we are going to send out. Now, when we looked at the specifications around which this lab would have to be set up, we realized that there are vast aspects around the system that we could not conform to. And some of these related to aspects about IP rating, EMC, and sound levels. What we did discover during our investigations was, although these capabilities we would not be able to provide in the ventilator test lab, through our work in the CPAP and BiPAP environment, we'd collaborate with a number of local suppliers who could provide these facilities to test. And this is some of the ways in which we had intended to bring in some of the aspects into the test lab itself. Just a block diagram then of what the system entails. So we have three main components in the system. The one's a gas supply system, and that revolves around a data acquisition system, a gas supply monitoring system, and a gas storage system. As we're currently in the process of developing this, what you see there is a render of what a gas supply system would look like. We then have a breathing simulator system, which would simulate a test lung, and a data acquisition system associated with that to measure all the relevant parameters required for a ventilator. So as you can see there, this breathing simulator is vastly more complex than the type of devices we'd acquired during the development of the BiPAP and CPAP devices. And then the third component around the test lab is the ventilator test software system itself. There was a need at this point to also automate the process of testing ventilators. So one of the key requirements around this was to automate as far as possible the different aspects around testing. So this would allow an operator to log into the system and based on the requirements of the ISO standard, guide the operator through the various aspects of testing the systems. Progress to date. So the project started in February of this year. We used the V-model systems engineering process to develop our systems. And in line with that, we've covered to date all the requirements and design phase. So we've completed that. We are currently at the process where we are busy with subsystem development and testing. And what needs to follow is the subsystem testing, system integration, system testing, and the final deployment. Together with SABS, we've identified lab space at their premises where the lab itself would be housed, and also the gas supply system. So this is a system that needs to be located outside for safety reasons. So we've identified those spaces currently at SABS. So just to touch on some of the challenges that we have faced in the development of this system. Firstly, a word around the standards. As it's not our field of expertise, as we started delving into the standards themselves, we started to realize that it's quite complex, difficult to follow, and it's difficult to synchronize between the standards. However, we had to upskill ourselves and try to make best understand what is required in terms of the standards. Cost was a huge consideration in the project. The budget for it didn't allow us to address all aspects of the standard. So, for example, we'd opted at some point to look at a commercial off-the-shelf system for the breathing simulator. However, we discovered that it was quite unaffordable. Some of these breathing simulators, although would have made the task of automation a lot easier, a single system was in the order of 600K. And that didn't fit within our budget. So we opted to localize some of those developments. And I think that's a key component, a key aspect in the development of the system is the aspect of localization. And what we realized that is we could develop similar systems, right, at a fraction of the cost from what we could acquire from abroad. And as you can see, that our current system is at 115K and substantially lower than what we could have purchased from abroad. However, there are certain factors that we had to remove out of the system, such as the automation aspect or reduce automation. So these were some of the trade-offs we had to look at. Through this process as well, we discovered that there was a need for a system called an oxygen generator. And this was to allow us to do endurance testing on the ventilators themselves. And also added a huge burden on the finance resources as well. And to be fully compliant with the standard is a costly affair. And that's the reason why we decided to focus on the three aspects I indicated earlier, so as to fit within the budget currently. However, there is an understanding that to become further compliant, there would be other further phases to develop and upgrade the facility itself. You might also be aware of the component available issue that we're currently faced with the IC shortages. And in order to address this specific aspect, one of the design criteria we looked at was the aspect of modularity. So that should we have issues in future around the availability of components or obsolescence thereof, we're able to quickly replace or redesign certain units as required. From a procurement aspect, and this is a challenge I think we face throughout the CSIR, the vetting and blacklisting of suppliers. One of the issues we had quite recently in the supply of components was that we'd gotten out in tender for certain components, and supplier was selected, and at the last minute when they were meant to deliver, they actually couldn't. And the understanding was at that point that this supplier had actually done this a few times. However, because we have not been able to vet or blacklist these suppliers, we have a recurrence of these issues. So in conclusion, what I would like to highlight here is that the test lab itself is a use case or a blueprint that fulfills a need specifically around the COVID-19 pandemic in terms of supporting a country need and supporting a capable state. What we have also understood or come to realize through this process is that there's a lot of aspects related to ventilators and ventilator test labs that we are not experts on. And therefore, in terms of skill building and even upskilling ourselves to be able to understand that particular application area is quite key. And through this whole process, there's been a huge amount of knowledge generation, both in the development of the different devices, the CPAPs, the BiPAPs, the ventilator test labs. And this knowledge is critical in allowing us to develop further systems and to support a capable state. It is also expected that as the CSIR, we would be able to transfer this knowledge not just to SABS, but other entities, other countries who would require similar facilities in their environment. So it's not just the generation of that knowledge that is important, but the ability to disseminate and transfer those to other entities and countries. And the last final point that I like to make, and this is, I think, a very important aspect, and that is around the localization and local support. Through not just this specific project, but through other projects, we found that, local support is a fundamental issue that we're faced with, especially with the products and the systems that we put out there. And one of the ways of addressing that is through this process of localization. As I've indicated previously, the ability to localize a system that is, unaffordable or the support costs around that, making it quite unaffordable. And one of the key aspects around this local support is to be able to address the full life cycle of a product. So where we have been focused on just developing the facility itself, one needs to consider the full life cycle in terms of maintenance and repair. And we find that to be quite a challenge. And having the ability to localize products better helps us to address issues of maintenance and repair and managing that full life cycle. And that is basically me for this presentation. Thank you so much.
Good afternoon. Thank you very much for the three presentations. They were quite informative. I wanted to find out here in South Africa, especially from DSI point of view or even from CSIR, are we in research responding to, let's say, to the needs of the country, industrially or economically in our research? Is there such a focus, as it were? And if there is there an effort to develop, let's say, skills at universities, making sure that all universities participate in developing such skills that are needed in the country, especially on big data, as Dr. Stoller was presenting earlier, and responding to the food security, as was also presented as well. So my question is these points that these presentations that you presented now, are they, as much as I'm looking at the country at large, I may also be asking, are they responding to the need the country has as at large. Thank you.
Okay. Who would like to go first? Thank you.
Okay. Now, thank you for the question. Let me take the first bite. What I can just say is that the program that I was talking about on high performance computing, it's anchored on national competitiveness. And immediately in South Africa, one of the things that we looked at is how do we make our own South African corporate to be competitive. So there is a program that we're specifically focusing on working together with industries to get access and help them to be able to leverage such facilities. And your second point in terms of human capital development, that forms one of our big initiatives in the country in ensuring that we develop these capacities in universities. And the program that I showed of the HPC, we call it the HPC ecosystem. And mainly we looked at how do we develop capacity in mainly historically disadvantaged institutions, but also extending that to make sure that we develop the skills in those institutions. I'm not sure if that's
let me just add on it also. I think I showed the last slide. My last slide showed Golden Goose. It wasn't research just for research purposes. It resulted to a company being created in South Africa in Welcome, which is running right now, and is employing almost 15 people. They have 4 of them are interns actually from the University of Bloom that are in that particular company learning on this particular technology. And it's not only it's something that is continuous. Like I said, we could do it alone, but it was easier with partnering with so many skilled people from France, from Belgium, from Germany, bringing all those their technologies. And we were lucky in this particular situation in that we could select what we want because we also have the expertise. I think my colleague, I don't know whether she's here, Dr. Nomusa was the one heading that particular project, and she's an expert in that area. So she could say, this is what we want and this is what we don't want. And this company is now running and giving jobs in Bloemfontein.
Thank you. Just further to add to that, specifically in our area in manufacturing, there's a big drive for the reindustrialization of South Africa, and specifically around supporting local industries, SMEs, in terms of taking them to the next level. There's a huge drive in terms of 4IR, in terms of IoT, in terms of getting helping industries and helping SMEs take the next step, in improving their current processes. And then to your second point around human capital development, one of the big initiatives within the manufacturing space within our area is I'm not sure if you've heard this before, called the Learning Factory. And this is a huge initiative where we are looking at upskilling and reskilling individuals from all walks of life in aspects related to 4IR, and to look at taking these learning factories to different parts of South Africa to enable TVET colleges and other institutions to implement these learning factories such that people are now reskilled in how 4IR, in how robotics, how automation, AI, and the like is going to change how we do things in future. So there are certainly initiatives to that effect.
Okay, thanks very much. Is there any hand? Yes, I see a hand there. Thank you.
Maybe just quickly, and it might be more a comment. I was in the Just Transition workshop this morning, and just sort of looking at the overlaps and the linkages between that, because one of the things that came out very strongly is the whole thing of reskilling and people's dignity and whatever. I don't know. I mean, I guess there will be, but how does one make sure that there are these links and these collaborations between? Because obviously some of what they want to achieve is also what want to be achieved here. So just to maybe a comment, or I don't know if there are any thoughts around that.
Any thoughts on that? rescaling and
Yeah, I think further to my point I made earlier around the learning factory, this is an issue that we have been thinking about quite a lot, and specifically around aspects of automation. And there's always this thing around people are going to lose their jobs and the like. Our focus has been on human-centered automation, so that you're not getting rid of a worker, but you're able to better utilize them elsewhere. So automation to the point where menial tasks can be to some extent automated, and then having to reskill or upskill those operators in other aspects. I think the key, I'm remembered of an example of McDonald's. You walk into McDonald's these days, and you don't necessarily have to go straight to the teller to punch in your orders, right? So you go up to a screen, you punch in the order itself, and your meal is served. And so what happens to the person who used to serve you? And it turns out that person now has been better utilized to support the customers when they're at their tables and help them with whatever is required in that. So I think that in its sense also speaks to how technology is an enabler for other avenues in terms of reskilling and upskilling people. Yeah.
all right, so let's take one last end. There was one there. Oh, okay.
What's the go-to market or go-to strategy or go-to-market strategy for the projects that you shared with us? That's the first question. How do they end up in the markets? Because it's interesting research, very interesting also if you're an entrepreneur like myself looking at them, thinking, hey, I could take one of those, or maybe they start their lives like that. I don't know. If I may just ask a couple of other questions to different panelists. And the second question is to Dr. Happy Sithole. What is the potential of replicating the partnerships that you're talking about into other areas beyond high performance computing? Because that's a great model. The North has resources. They finish using a system, a product the South could use if it still has a life. One last question. It might be answered by one of the previous panelists, probably Toto Matsiriso, and it's about climate change, pandemics. These are new challenges that require diplomacy to be tackled. And the new pandemic will need a huge amount of diplomacy. What work is taking place to ensure that we are more ready as Africa, as a collective, to tackle the major, catastrophes that could be coming our way? In fact, some of them are already doing that. Climate change, for one.
The way we work at the CSIR, in most of my projects, I like to work in a consortium. So before we start the project, if it's a commercial related project, we have an SMME involved. We call it private sector. It could be a small SMME or big SMME. So we already know that this product is going to be targeted to a market. That's how we do it at the initial onset of the project. So we do the technology, do everything, but the SMME is also there in it. I mean, I'm currently working with 20 SMMEs in the cannabis space, and all of them have their products. We look at them. Some of them come with around 20 products, like I mentioned in my presentation today, and we reduce it, do some market research, and say, no, why don't you focus on these 2 or these 3 products? Because those are the ones that are going to take you to the next level. So we bring them from the onset and then work with them. Yeah.
Yeah, I think on the part of can you be able to reuse or take this strategy to other areas? It is important. The point that you raised is what we have to look at is to avoid dumping. And we always have to assess whether this thing will be useful. And I would say that one example that I have, and which came immediately when we had this discussion, was the building of the telescopes in the various countries, on the 8 partner countries, it's obviously going to take a long time and a lot of investment. And immediately to build the skills, that's where this model was adopted, to say, let's get some of these portable telescopes that we can be able to put to the 8 partner countries. Then we can skill the people in operating smaller telescopes. So we immediately implemented it there. But I think it can be used in many other areas, as long as we check that we're not using Africa as a dumping space. And other programs like climate change, I did indicate that there was this humanitarian award. And the humanitarian award was offered specifically because on the climate change, what we realized is that most of the African countries, that the forecasting models that they use are adopted from other countries. And we don't have a regional model that can really be able to demonstrate or be able to warn African countries in a consolidated way. If you go to Mozambique, they will use something that comes from Portugal. In South Africa, we use a unified model coming from the UK. Somebody's using something that comes from Australia. But the climate impact is consolidated. It affects Africa. We need to have a model that talks to all the African countries and can use all the inputs and tell us about globally how Africa is going to be affected. So that's one of the initiatives that is being taken to develop a regional climate model.
All right. Who's got a mic? Thank you.
Thanks for your question. I think from my side, I think there's quite a lot that can be done. And as South Africa, I think one of the things that has been happening is to keep on profiling South Africa as one of the best international partners, so that when our experts or our scientists participate in other forums or dialogues, we have a voice. I mean, I ended my presentation by saying we should stop competing, but rather collaborate. So, and I'll make an example of, and it's outside climate change. Say, my experience has been that when I look at how international projects goes, you find, for example, there's a project, say on even if it's climate change or any other, you find that there will be 3 universities in Belgium, 2 research organizations, and so forth, and also with other countries, like the consortium of about 27 partners. And you look in, maybe the South Africa is part of the consortium, and there's only 1 university. So regardless of how loud they scream, they wouldn't make an impact. So one of the things that we should start doing as the national system in South Africa is to start collaborating amongst ourselves. And this will also help us to make proper and meaningful contribution to COP27 and as they move along. And also there are other platforms where climate change has stopped to be a North issue only. I think there used to be this myth that no, climate change is not our issue. It belongs to the North only. But we can see now, I mean, it's October. We just had our first rain a few weeks ago. We used to have our first rain in August. So it goes back to the question of how do we learn and put more funding into research in those areas. Biodiversity and those areas are areas that are mostly getting less money, and when you look into other areas like your health innovation and so forth. So it goes back to the more money we put, the more expertise we get into the area and the more meaningful impact we can make. Thanks.
All right. Thanks very much for that, ladies and gentlemen. I think given the time, I would like to thank my panel, this one, as well as the previous one. Thank you very much, gentlemen. With that, we've come to the end of our session today, and I would like to thank you for being with us. This is the last session for our conference here, am I right? And for you to be still here is highly commendable, and we really are grateful for that. And with that, I would like to hand over to Dan to close this session. Thank you. Thank you.
Thank you very much, Dr. Malinga, and I'll be very brief, but just to briefly reflect on three of the comments which were made, and then some very brief concluding remarks. Firstly, when we interrogated international relations and international partnerships, the key principle which came to the fore, and which is absolutely essential, and it doesn't only apply to South Africa. We do not collaborate internationally for the sake of international cooperation. It is how does it advance our national interests. So your international cooperation agenda should be based on your national objectives. And South Africa is very privileged, thanks to the leadership of the Department of International Relations and Cooperation, DIRCO, that we now have a document which is publicly accessible, and we will share with everyone the link where you can find it, called South Africa's National Interests. What are South Africa's national interests within the global environment? And it's those national interests which also shape our engagement globally. So, for example, and Toto and Mampe spoke about it, when we look at accessing international resources, international funding, it is how do those complement our own investments in order to achieve our national objectives. Because Neville, if he's still here, I don't know, he made the point that often the risk of international funding, international partnerships, is that it could distort your own national agenda and your own national partnerships. So that was a crucial point to make. Then secondly, the gentleman who asked about how does our different efforts correspond to our economic interests, our South Africa's industrialization objectives. What I want to emphasize here is that if you look at the decadal plan, which is the second strategy document I emphasize, is there are no priority scientific themes identified. There are no priority technology domains identified. It's all about societal challenges. Our mission is science and technology responding to the needs of society. So in that document, the point of departure is what are the challenges society face? It's a healthy population. It's skills for the future. It's energy security. And then we look at how do we harness and mobilize scientific investments, technology platforms across a whole range of domains, including the social sciences and humanities. My minister would insist that we emphasize that, and rightfully so, because it's how we harness science in a multi and a transdisciplinary way to respond to the needs of society. And then with regard to the question about how do we prepare for the future pandemic, I think an absolutely key component of that is, and Mampe spoke about that, is for us to continue to work to reinforce and further develop our structures for regional and continental integration and cooperation, such as the African Union, the Southern African Development Community. I'll never forget when Minister Pandor used to be our minister, and at the time of the Ebola outbreak, we were in office, and she said we could never allow the fact that Africa is so vulnerable in order to respond to a pandemic, because in responding to Ebola, everything came from the north. And sadly, to some extent, that happened in COVID-19 as well. So this is really, now is the time to make those investments. And it's not only, and I think that's important to also emphasize, it's not only responding and protecting and advancing our own continent, but as we say, no one can be safe until everyone is safe. So Africa has a crucial role to play also as part of the global effort to advance global health. So thank you very much for everyone who participated in this session. I think we did more than justice to the theme of science diplomacy. We spoke about all the key themes, global challenges, which requires a science diplomacy response. I think it was a lively discussion, strategic one on how we should collaborate internationally. And ultimately, I think we also spoke about just how does science bring people and countries together. So thank you very much, and best wishes to all.